It's more than dry January for Jack Barkley. He hasn't had alcohol for 3 years. There are a number of reasons he stopped drinking, but as a healthcare professional, the link between alcohol and cancer was one of them.
A lot of people in my family have a history of diabetes, liver disease, various forms of that, and cancer. And I know that does play a role in with alcohol. It increases those risks of certain comorbidities.
Those risks have been even more clearly laid out by a new U.S. Surgeon General advisory on alcohol consumption and the link to cancer. In a 22-page advisory, Dr. Vivek Murthy said for certain cancers like breast, mouth, and throat cancers, evidence shows that this risk may start to increase around 1 or fewer drinks per day. Murthy is even calling for updated health warning labels on alcohol containers, but some doubt it will change habits.
Just like cigarettes, it's not going to stop everybody from smoking. It's not going to stop everybody from drinking.
Canadian researchers have conducted a real-world evaluation of warning labels on alcohol containers. They point out even some packaged foods will have that type of health information on them in 2026.
Yet alcohol containers are exempt from these warning label regulations, so there definitely is a strong opportunity to strengthen warning label regulations in the country.
The Canadian Cancer Society agrees and would like to see similar labeling like what started on cigarette packages.
With 40% of Canadians not aware that there's a link between alcohol and cancer risk, it's really important to have that messaging kind of at that point of sale, at that point of consumption.
Health Canada has yet to comment on the U.S. Surgeon General's new advisory. However, in 2023, the Canadian Centre on Substance Use and Addiction did publish guidance on alcohol and health. It said you're considered at low risk if you have 1 to 2 drinks per week. Heather?
CTV's Mike Couture in Ottawa.